a lot of gay men went through that period where they thought they were going to get HIV, certainly, but they were also going to die from it. And I think that brought on a lot of shame and a lot of stigma. And you have to understand the stigma was based on the fact that you brought this on yourself. So there was this perception among gay men that this was an inevitability. I was going to get HIV and I was probably going to die. And I think that frightened a lot of people to death, particularly when they saw celebrities dying. Rock Hudson died, Liberace died, famous people were dying. And you thought, well, if they can't find the right doctors and if they can't find a cure, what chance do I have? So I think a lot of gay men went through that period where they thought they were going to get HIV, certainly, but they were also going to die from it. And I think that brought on a lot of shame and a lot of stigma. And you have to understand the stigma was based on the fact that you brought this on yourself, that HIV is a completely preventable disease, but you allowed yourself to get it. And I think that's what led a lot of gay men who suspected they had HIV not to go to their doctor or not to tell anybody because they were in fear. And at that time, the gay cancer that we refer to as Kaposi sarcoma, which were lesions, they're dark brown lesions that appeared on the face, and sometimes you couldn't hide those. So now you were marred like the scarlet letter, and everybody knew that person has HIV. And when I first started practicing, I remember going in the local Chelsea neighborhood, which is very gay-centric, and I remember seeing men suffering from lipoatrophy. That was loss of fat in their face. They were also getting fat redistribution, like the buffalo hump, very skinny legs. And so these men looked like they had HIV. And that was completely stigmatizing. You couldn't leave your house now without anybody thinking that person's sick. You know, a lot of men went through that period where they didn't want to lose weight. Being skinny was perceived as being HIV positive. So that stigma carried on for many, many years, and not until 1996 when we had the advent of the protease inhibitor, which is a class of drugs we use to treat HIV, and that regimen is called HAART, or highly active antiretroviral therapy. Once we had that, we started converting patients from dying into patients that were chronically ill, and we were just treating them with HAART, but they're on HAART every day. They have to take that for the unforeseeable future. And we do know now that that was preventing people from dying imminently, but still there were side effects, and still they were taking many pills multiple times a day. So again, that added to the burden. Now you couldn't go away because you had to bring all these pills with you, and you were going to the airport and they were asking you why you had all these pills, or you know, your friend opened your medicine cabinet. Some of them had to be refrigerated and you didn't want your mother to come over and look in your refrigerator. So it was really embedded in the fabric of your life that you had HIV and you had to embrace it. And a lot of men, I think, just couldn't do that, and they would rather die than have to face that stigma of being identified as HIV positive.